One thing I can't forget, I have my mom and my dad here, and I'm very grateful to have both of them here. My mom, so she reminds me to mention her case, which she always gets angry about if I don't mention her. And my dad, because everyone needs someone in their life that when they're preparing, you guys I'm sure have prepared projects and done assignments and had to get things ready for your kids, and you need that one person that's constantly saying, how's that talk going? How's that talk going? Just in case you weren't stressed enough about it. So thanks, Dad. And he's, 81, carried 8 cases of water up here, so it's my dad. So, all right, so this is what I do. This is my naturopathic doctor license. This takes, to get this license, takes 4 years of 16-hour days. It is beyond difficult, but it's worth every minute. The conventional friends of mine that I had that went to conventional medical school, this is a license from Naturopathic Medical School. When I went to school, there were 2 in the countries. My conventional colleagues tell me that I went to basically 2 medical schools, because naturopathic doctors like me, we learn everything about Western medicine. Now, we don't do surgeries, so we don't go on to do surgeries, but we learn everything about drugs and Western medicine and biochemistry and physiology and anatomy. That's part of our medical training. Then we learn everything about the natural medicines, whether it's homeopathy, herbs, nutrition, you name it, we're exposed to it. Some of it a little bit fringe, but we know about it. You're not going to surprise us if you ask us about something. If there's something we don't use, it's because we've seen it and we choose not to use it. So that's naturopathic doctors. All right, so let me tell you about my story so you know why I'm talking about this today. When I was 19 years old, I went into the Marine Corps. And in the Marine Corps, I got a series of shots before a special deployment. Now, everyone in the military is special, so I was just a grunt. But before I went on this deployment overseas, I got a bunch of shots. And when I got back, I got sick immediately. My sickness was I got an abscess, okay? And it's called a perianal fistula. It's basically an abscess where your intestine gets an infection and the infection finds another way out of your body. So they had to do surgery on me, and the surgery was not very successful. And I was in a lot of pain and discomfort. And at that point, a couple months after that, I had a choice. I could do another surgery and go through more pain, or I could get out. So I chose to get out. And I went to Stony Brook, and I still had this kind of chronic abscess to deal with, but I was keeping my head above water, and I went to Stony Brook, and I loved Stony Brook, great school. But as I started going on the years, I started knowing I had to go to the bathroom more and more frequently. I didn't think about it. Who thinks about that stuff? I'd have to get up from class once, then twice. By the time I graduated in '88, it was hard to sit through a single class. And after I graduated, it went from bad to worse. And for me, my disease was ulcerative colitis. And I'd have to wake up, it's hard to believe, 20, 30 times a night for years. So this was going on for 2, 3, 6 years. Now, I was born and raised in Port Jeff, so I went to all my doctors. I wasn't stupid. I was sick. I knew I was sick, and I went to the doctors. They gave me drugs. They didn't work. Finally, I got frustrated, and I said to my wife at the time, Dr. Roseanne Nenninger, I said, I'm going to go to the best. So I did research. I found the best, the Park Avenue guy with the leather-bound volumes and the mahogany desk. Okay, and I went there, and I waited for 3 hours, and he saw me for 5 minutes. He brought me back to his office, and he said, I got a cure for you. And I was like, finally, I found the right guy. I have a cure for my condition. And he's like, I'm going to cut out your colon, and I'm going to put you on a life on drugs. And I don't know what went through my mind, but I got up, I turned around, and I walked out. And I did not know where I was going. Like, here I was. I knew I was sick. I mean, that trip to Manhattan, I probably had to stop 20 times. I mean, by that time, I knew every bathroom on Long Island, trust me, you know? So I knew I had to get better, so I went to Port Jeff Library, and I looked up in the card catalog, alternative and medicine. And I pulled a magazine article out. It was about a paragraph long, Talked about naturopathic doctors, how they go to a 4-year medical school and they learn everything conventional Western doctors learn, and they learn everything about natural medicine. I said, one of these people has to be able to do something different. There were none in New York State at the time, so I drive 3 hours each way to Connecticut, where it's licensed for 80 years, and 3 hours back. Now, that doctor didn't cure me, but he did one thing for me. I looked him in the eye and I said, "Do you think I can get better?" And he looked at me and he answered me from his heart and he said, "I know you can get better." And I believed him. So that was my path. I didn't start getting better with him, but I stopped getting worse. And a little bit better. We turned the corner a little bit and I said, I can go to naturopathic school and I bet I can figure this out. It was a little harder than that, but that's what I did. So, you heard my story about me, okay? 15 years of ulcerative colitis. Everyone that had the same intensity of symptoms that I did at that age is dead. You can only go on for prednisone for a certain number of years before you get cancer. Inflammation plus immune suppression equals cancer. Inflammation, colitis, immune suppression, prednisone, you get a tumor and you die. Okay? So my story is that I'm here and I'm healthy today. And I like being that way. So I became a naturopathic doctor. I had full-on colitis through most of my naturopathic school, and it was really tough, and I did it anyway. And I came back to New York State, and I sat down and I started practicing, and slowly with the help of my patients, I'd help them get better, but I'd learn something for them, and I'd help myself get better. So incrementally, I started figuring things out. And now, after 17 years of doing that, I'm pretty good at figuring things out. And I want to share with you exactly what I know, not holding anything back. Now, obviously, you're not going to understand all of it, but this is what I want. I want you to know there's alternatives out there and have an idea of where they may be. That's what I want for you.